Hi everyone, this is Dr. Todd Cohen at Forsight Vision. I want to discuss the importance of taking care of your health and how it affects your eyes. Over the weekend, we had a patient with a very serious neuro ophthalmological emergency. This patient, who's been having symptoms for several weeks with her body, she's had pain upon chewing, she's had some veins that were kind of popping out here, and she's had overall muscle weakness. She went to her internist a few weeks ago and she told the doctor that she's been feeling weak. She didn't go into the other things about her veins or about her jaw pain. And so the doctor prescribed her like a muscle relaxant to help her leg pain. Then she comes in this past Thursday saying, Dr. Cohen, I can't see anything out of my right eye. So upon thorough examination, and this is exactly why at Forsight Vision, we have the latest technology to image the health of the back of the eye. We conducted a peripheral vision test, an image of her optic nerve, which is part of the brain, as well as a scan that takes 80,000 images a second of the back of her eyes to take a look if there was any issues. Unfortunately, she couldn't see anything out of her right eye, complete darkness. Her pupil wasn't reacting to light. And this is called giant cell arteritis. So what I did as her primary eye care provider is I called 3 neuro-ophthalmologists. Those are eye doctors that specialize in neuro-ophthalmology. And I called all 3 of them, trying to get her in as soon as possible. 2 of the 3, one wasn't available, the other one was on vacation, and the third one I was able to contact in Highland Park. I talked to our doctor, our referring doctor, and I said, she needs to be seen right away. And at first he said, well, I can get her in tomorrow or the following day. I said, absolutely not. This needs to be taken care of right away. And he did us a favor and got the patient in the same day. She went right from our office over there. And as it turned out, she needed to be admitted to the hospital directly. I've seen this in my clinical training over 22 years ago, but fortunately haven't seen this in my own office. And this was the first time, hopefully the last time. So I was 100% correct with diagnosis. I co-managed with the neuro-ophthalmologist as well as the internist. And I spent about 25 minutes myself coordinating all the care. She was then admitted to the hospital after seeing the neuro-ophthalmologist and given the appropriate care. I've checked in with the patient several times, and although the likelihood of her vision coming back in her right eye is very slim, most importantly, on the overall picture, this type of diagnosis, which is called giant cell arteritis, affects your blood vessels throughout your whole body, including your heart and all your vascular systems. So although the vision won't come back, she now has a cardiovascular specialist, she has her neuro-ophthalmologist, and she has a rheumatologist to kind of get to the root of the cause of this. So this just goes to show that providing full comprehensive eye care is very important, and is always something we pride ourselves in, be able to correctly diagnose, treat, and manage, and especially work with our referring doctors if something like this arises. Thanks, and have a great day.